Dawn has never been so bright and so beautiful than the day Junior Dlamini came into this world. At least, that is what his mother would say as she recalls holding him for the first time. He had 10 little toes, round cheeks, and smelled of innocence, of promises, and endless blessings. Joy rose inside of her, unlike anything she has ever known. Looking into his glorious face, she knew only the best life has to offer was good enough for him. Love to cradle him, happiness to carry him, success to support him, and health to sustain him throughout his journey.
We all dream of a long and healthy life for ourselves and our children. But do we consider that we are all born into a special set of circumstances with unique challenges based on where we are born and to whom? In South Africa, babies like Junior have a 96% chance of making it to their 5th birthday. As a male child, his life expectancy, according to the latest research, is only 50.7 years.
Luckily for Junior, he was as blessed with his mother Joy as she was with him. She nourished him before and after he was born with only the best she could. Before long, Junior was 5 kilograms and as sweet as a bag of sugar. Grannies and aunties came from far and wide to squeeze those cheeks, showing him off like a rare gift to all who would be so fortunate as to lay their eyes on him.
Family matters, and not just one generation. Your ancestors have left a legacy that has been passed down to each individual and results in your genetic code that influences not only how good-looking you are, but what happens deep inside your body's cells.
Now, Junior's mother, a responsible woman, took him to the community clinic to get immunized against many dangerous diseases as he grew up.
According to the World Health Organization, more than half of under 5 child deaths are due to diseases that are preventable and treatable through simple, affordable interventions. Strengthening health systems to provide such interventions to all children will save many young lives.
Junior survived his childhood with only a few trips, sponsored by his own curiosity, to the bright lights of the hospital emergency rooms.
Not all South Africans are lucky enough to pay a visit to a private hospital when they are traumatized by life's unexpected events. Parents want to provide their children with the best health care, but this is not always possible at all public health care facilities.
Junior's dad, a lion of a man, took the family on many trips across the breadth of the land, supporting family at times of fortune and misfortune. Sometimes Junior got sick, and their trips included long waits and once-off visits to the public health doctors, who didn't have the pleasure of knowing Junior or seeing his medical history.
Our health information systems are not integrated, with most patients' medical information sitting in old paper files in different doctors' offices and at various medical institutions. This means time that could have been spent on diagnosis is spent on administration. And something like an allergy can easily be missed with dire consequences.
As a teenager, Junior shared a lot. He shared the fast food treats he loved so much. He shared his ideas on how to change the world and what music to listen to while you are at it. He shared his explosive moods and his seasonal girlfriends.
Puberty and thereafter student life is a breeding ground for communicable diseases, with bad habits contributing to lifestyle diseases later in life. At this time, health is a non-priority. High-risk social factors are at play, and the youth perceive themselves to be invincible.
Like other young adults, Junior had a few tests done, some willingly, to match his interest in education and social life. But it was only after his 25th birthday that Junior, now somewhat overweight, made his wife-to-be pregnant. This launched him into a real career with an all-important but far too expensive medical aid to pay for his new wife's checkups.
Our country has the highest incidence of HIV in the world, which has led to 29% of all pregnant moms being HIV positive. We rank third for TB, and these two diseases are now linked synergistically. Combine this with the rising costs of healthcare and the fact that most South Africans can't afford private health care, and you can see why government faces many serious challenges. The Department of Health shares parents' vision of attaining a long and healthy life for all South Africans. But like Junior, we truly are battling the odds. Consider the 4 key challenges that beset the national health system. A complex quadruple burden of diseases, serious concerns about the quality of public health care, an ineffective and inefficient health system, and spiraling private health care costs. This is why the Department of Health is steering towards their National Development Plan for 2030 to raise life expectancy, reduce maternal and child mortality, reduce non-communicable and communicable diseases, and reform the health system to support these goals. But 2030 is such a long way away that the department has come up with 9 short-term priorities that will help us get there. They also tie in with the African Agenda 2063, which envisions the necessary infrastructure to accelerate integration, growth, and technological transformation. Address the social determinants that affect health and diseases. Strengthen the health system. Improve health information systems. Prevent and reduce the disease burden and promote health. Financing universal health care coverage. Improve quality by using evidence. Improve human resources in the health sector. Review management positions and appointments and strengthen accountability mechanisms. Meaningful public-private partnerships.
Junior's mother dreamed of a long and healthy life for a precious son. Junior's wife wants to grow old with him, and his daughter wants her dad to be at her wedding. Knowing Junior, he's definitely not ready to stop living life and give up everything and everyone that he loves at the young age of 50.
All South Africans deserve a long and healthy life. To extend life expectancy, to minimize our particular risks by addressing the many challenges we face, we need to all be part of the solution. One such proudly South African solution that addresses our nation's health needs is Intellovate Health, an integrated electronic medical record system that complies with e-health strategy standards and improves the efficiency of clinic care. It aligns with the African Agenda 2063, which aims to build and expand an African knowledge society through transformation and investments in technology, research, and innovation, and supports the Department of Health's priorities in the following way. South Africa's TB epidemic is worsened by poor adherence as a result of patients not being initiated on or lost to treatment. As a result, they expand the pool of infection and also develop resistance to the usual treatment. As an information system that keeps track of patients' tests, treatment, and visits, Intellovate Health can help healthcare manage the spread of TB and drug-resistant TB. As a secure cloud-based medical information system that integrates hospital and clinic records, Intellovate Health connects all facilities, departments, healthcare providers, and pharmacies involved in patient care with the patient at the center, no matter when or where. With information at the fingertips of doctors, more time can be spent on patient care and diagnosis as opposed to administration. Diagnosis will also be more accurate. And with optimized records, patients can confidently choose clinics as their first point of contact. Monitoring and accessing patient and medical information, historic and real-time, allows doctors to make better decisions and reduce mortality rates. Universal health coverage will be possible once universal health systems are in place, linking systems nationally and providing valuable data to the department to improve decision-making and strategies. Through Intellovate Health's fully integrated system and reporting, interoperability, increased capability, and efficiencies are addressed. Intellovate Health supports practice management and features reporting based on data such as patients, diagnosis, medications, billing, and much more. This reduces manual and paper-based work, allowing resources to focus on their core responsibilities. Delivering on public health strategies and facilitating the achievement of priority and overarching goals through e-health support is the capability, intelligence, and expertise Intellovate Health brings to a meaningful public-private partnership.
Junior has beaten the odds so far and is looking at a long and healthy life spent at the side of his beautiful wife, running around, playing soccer with his grandchildren, telling stories of a magnificent past to all who would listen. In life, he has always exceeded expectations, but what he would most like to do is live beyond expectation.